Hi, and welcome to this episode of Care Center for Internationally Educated Nurses podcast, focusing on long-term care. My name is Vanessa Veda. I am a registered practical nurse working in long-term care. Additionally, I am a post-diploma Bachelor of Science in Nursing student conducting my final clinical placement here at Care Center. I have the honor of being the host of this episode where I will interview 3 clients of Care Center, all who have experience working in long-term care here in Ontario. As many nurses start and continue their career in long-term care, this episode will provide a glimpse of what it is like, as well as highlight the unique professional journeys of all 3 of our guests. Without further delay, let's get started with our first guest. Okay, so hi Amandeep, thank you for taking the time to speak with me today. To start off, would you like to just share a little bit about yourself, your current role, what setting you're working in, and maybe a little bit about your nursing background, which led you to where you are today?
Hi, my name is Amandeep Wow. I am an RN. I started as an RPN and I was working in a long-term care facility. I worked in Muskoka. I worked there for 5 years. Then I got a job in Etobicoke long-term care home. And currently I'm working as an RN at William Osler Hospital, Etobicoke. Yeah, I think that's about me.
Okay, great. So you worked both in Muskoka, you did long-term care there, and then in Etobicoke you worked at another home in long-term care.
And yes, they both were long-term care homes.
Okay, and when you were working in long-term care, were you working as an RN or an RPN?
I was an RPN.
An RPN. Okay.
Yes.
What did you like about working in long-term care?
The thing I like about working in a long-term care home was having interaction with seniors, because it's in part of our culture to respect the seniors. So I liked having conversation with them, being able to help them, listen to them, and provide them care.
Yeah, that's great. Do you mind me asking what your culture is?
I'm an Indian.
Okay.
Yes.
Okay, cool. Yeah, that's I also working in long-term care and love that part too of building those relationships, and you can learn a lot. You can learn a lot from seniors, right? They have a lot of life experience, and
Yes.
yeah. And when you were working, what did you find as a challenge of working in long-term care?
One challenge was working with dementia patients, and I worked on a dementia unit for about 2 years full time. I felt it was hard to understand in the beginning what they're trying to say, and to redirect them if they're trying to exit seek. Those were the situations which I found hard because their behavior is very unpredictable at times.
Yeah. Was it kind of like a locked, like, secured unit that you were working on, or?
Yes.
Okay.
Yes.
Oh. And so this podcast is kind of designed for future RPNs of long-term care and RNs, of course, as well. And so as someone that has experience in long-term care, what is a piece of advice that you would give to nurses considering to work in long-term care?
The nurses, I don't really think I'm in a position to give an advice, but yes, I can give them just a friendly suggestion that do not give up. In the beginning, it was really hard. It was kind of shock because in when I was studying, we used to say in Western countries you do one-on-one care, but here it was a big shock when I realized that on my unit it was an evening shift. So from 3 to 7 I was giving medications to 32 people, and after that I had to give medications I had 60 residents under my care.
Yeah.
So it was a rush, but I tried to keep my sane and try to do my best. But the advice I can give is like always try to seek advice for something that you know.
Yeah.
And I heard from a senior nurse, like if something you don't know, you don't know. It's better to ask than making mistakes.
Yeah.
And another thing I found was, like, since we work in a long-term care home, I was really young. At that time, I felt like I'm young, like this senior staff is not in my age group, so I may have a different choice, or like they may not talk to me, but that's not true. You can find I'm trying to find the word.
Yeah.
You can find like companionship or like bond with someone who is pretty older than you.
Yeah.
It's always nice to talk to someone if you can. Like, do not think like they are very senior. They may not like this and that. It's better to share your opinions, I guess.
Yeah, I think that's great advice, especially like you said, for young nurses. It can be a little bit intimidating in a new job, and especially if you're new to even a country or wherever it may be. And like you said, like, don't use age as kind of an excuse for not connecting with people, because I think it's so important that, especially as nurses, that we work together and share our experience,
and I
right?
find that common with male nurses too. Like we have to learn, like we always have to maintain our professional relationship.
Yep.
Like whoever we are working with, that's what we get. It's always good to share your workload. Do not think like this person cannot do this, I cannot do this. It's always good to discuss with others.
Yeah, that is great advice.
And another thing I can say, like in the long-term care home, we don't see registered staff a lot. I learned a lot from PSW staff. It's kind of intimidating at times when they know most of the policies and procedures.
Yeah.
They say, you didn't do this right, you didn't do that right. In the beginning, it was tough for me to understand, to get the directions from someone. I was thinking like they're being insubordinate by telling me.
Yeah.
But I learned it a hard way, that it helped me in the end to tell me about what had to be done and how had to be done.
Yeah, totally. For myself, I've worked now for 2 years in long-term care, and there's some PSWs, personal support workers, that have worked on the unit where I work for like 25, 30 years. So it's like you can't even compare our experience, right, and our knowledge with that amount of time. So yeah, that's a very valid point, because I think that's also a very big part of long-term care, is overseeing kind of unregulated professionals and supporting them and working together. So that I'm really happy that you brought that up. That's a really big aspect. Yeah. Wow. Okay, awesome. So as you might know, Care Center is celebrating 20 years of success. And so to kind of highlight them and put a little, shine the spotlight on them, I was just wanting to get some feedback of what did you value most as a client of Care Center in your journey becoming a nurse here in Ontario?
Okay, for sure, yeah. So when I came in 2010. It took me, I think, 1.5 years to get my license. I took coaching from a private institute.
Okay.
And once I got the license, I thought that was it. I thought like I will get the job right away. I won't have any problem. But that was when the actual story began. I realized it's really hard to find a job in nursing at that time. And because I didn't have any references, I didn't have any Canadian experience, my communication skills were not great. So I ended up, as one of my friends suggested me, that there is a center that helps internationally educated nurses, which I found very interesting. So I went to see. At that time, it was Norma. I went to saw her, and she was very good at guiding me and telling me, and she did my assessment. So I did one exam, I think, and she brought up what I knew. So that was nice to know. And I was volunteering at that time. And luckily, I think within 1 or 2 months, I got the job. And good thing I had a reference. Because that was a good, because that to have a professional reference from someone was a positive point. And another thing, like their communication classes are really good. I enrolled for them, and but I didn't get to like complete a course at that time.
Okay.
But I did that like once I had to do my OSCE exam for RN.
Mm-hmm.
It was in 2018. So that course I found really helpful because I did not know how to do that. I didn't know what the exam was like. So the teachers were really knowledgeable and experienced. So yeah, and they did like communication classes are really good. So I found that part like really interesting. Even though I was working as an RPN at that time, I realized that what I had learned from those classes, I can use them as like good skills.
Awesome. Great.
Yeah.
Well, thank you so much for taking the time to speak with me today. And it was great to hear, although short, just about you and your experience. And wish you all the best and to stay safe. And,
Thank you.
Yeah.
Okay, same to you.
Okay. Hi, Chris, and thank you for taking the time to speak with me today. I'm just going to start off and ask you to share a little bit about yourself, your current role, what setting you work in, and perhaps a little bit about your nursing background, which led you to where you are today.
Okay, great. Well, so it's a bit long, but I'll try to be brief about everything.
Yeah,
I've been
no
a nurse
problem.
for over 20 years. I started my training as an ICU nurse and climbed up to academic, and eventually leave my hometown and work in Singapore as a nurse educator there for almost 12 years.
Okay.
Did a lot of rotations in different settings, acute hospitals, geriatrics, daycare centers, nursing homes,
Wow.
most of the things. Yeah. And then eventually, I decided to move to Canada, and then I know it's going to be a challenge. So I've settled everything before I left Singapore, and I thought that things will be okay, but apparently it didn't. So I come across Care for Nurses, and I registered and create a profile. And I think Care for Nurses are very accommodating in a lot of ways, especially for internationally trained nurse. My case manager, Michelle, gave me a very comprehensive view of where I am, what am I supposed to do after all the CNO has given me those reports and advisory reports of my education. So eventually I started registering as RPN, and I also applied for RN at the same time, but RN is the one that gave me a lot of challenges. I have to go through a lot. So I began my work as a PSW. In fact, I did took some bridging course, personal support worker. So I started to work as PSW while waiting for all my registration to complete.
Yeah.
So I take care of some clients with dementia, and I did some courses as well in terms of Alzheimer's, dementia, all these things. And to add on to something, because I really want something else, so I registered with Red Cross, and I am a first aid instructor as well with Red Cross. And eventually, when I got my RPN, I just jumped into a retirement home. So there was a charcoal retirement home that's going to open in downtown West Side, and it's a 300 capacity retirement home. So we started from scratch. So I applied as RPN, but they hired me as director of care.
Oh wow! Okay.
So probably because of my experience.
Yeah.
So I pretty much built the whole nursing team from scratch. I hired PSWs, I hired nurses, I trained them, and at the same time building the capacity of our nursing department there.
Wow.
So I stayed there for roughly around 8 months because I want to focus. As soon as the CNO gave me the noticed that I can take either I go for my continuing education to suffice my gaps, my knowledge gaps or education, or I take the OSCE. So I take the shortest route, and I took the OSCE, and I told my manager I need to resign because I need to focus on my RN exam, my OSCE. So from then on, I started reviewing for my OSCE, and then by December I sat for the OSCE, and fortunately I passed it as well.
Yeah.
And as soon as I got my RN, another retirement home, can't wait to offer me another DOC position. So it's around Amica Senior Home, and I worked with them for almost 7-8 months. And I thought I need to move forward, and I need to see how the actual hospital settings are here.
Yeah.
So Unity Health Toronto actually offered me a job. With all this COVID going on, they offered me a full-time position,
Awesome.
temporary full-time position. So I work as a staff nurse in an activation center in their unit. Yep. So I've seen how the nursing healthcare delivery system here in Canada looks like from the retirement home perspective to the active hospital perspective. So it's pretty much a very good background and eye-opener. So with all this pandemic going on, how in demand our nurses are. So Sunnybrook called me, offered me a permanent full-time position. And here's another one which offered me another management position.
Wow.
And looking at all the backgrounds, I said, okay, I think I will choose the nursing home, the management position, because I've not worked with long-term care before. So that was it. I signed up with another nursing home, which is currently I'm working as a nursing manager there. I would say it's a very good opportunity for me, not only to carry out my managerial skills and competency, but at the same time, I always have a hands-on on what's going on with the routine. I'm a very hands-on nurse. So I always, even if my nurses reports to me this, I don't, not say I don't trust their competency.
Sure.
They are very competent, but I always want to see what's going on personally. So I usually go in and see. So it's part of the routine that I do now. And working in long-term care gives me the opportunity to work, like I said, a manager position, do an admin work, carry out my leadership skills, coach the nurses whose skills are not as enhanced, I would say. So I do education, a lot of education there, and I perform a lot of hands-on care with the residents as well. One of the things I think that I enjoy currently now, because I'm taking the palliative lead nurse in our nursing home, so I'm a palliative nurse as well.
Yeah.
I took some certification for the palliative course in Pallium, Canada, and I started from there. And I think one of the interesting aspect of this role is talking to the family on whether should we put the resident in palliative, should we send them to the hospital, those kind of things. I think these are the very sensitive conversations that some of the residents' family doesn't really want to talk about. But it is what it is. I not say I find joy in discussing all this death and thing kind of thing, but I find joy in educating the family members on the trajectory of the conditions, those kind of things. So currently, that's how my role looks like.
Wow.
And then, of course, the add-on pandemic, we swab staff, residents here and there. Do a rapid testing. Do counseling. At the moment, these are some of the things that are going on in my role, and I think Care for Nurses has been good up to now, because they're still communicating with me, and they're still asking me some of the things where I can help and stuff like that. I did promise to them that if ever there's a need for me to come in just to coach some of your internationally trained nurses doing training there, let me know. I can come in, and I can, I think as a nurse educator for over 20 years, it's always been my passion to just come in there and grab that opportunity.
Sure.
If I identified some learning gaps, and I will just, do a teaching moment with them.
Yeah.
Yeah. So,
Wow.
yeah, that's why, yeah.
That's awesome. Wow, I'm kind of speechless of your experience and especially even to point out your start here even in Ontario as a nurse. That's a pretty cool place to start, expecting to go in as an RPN and being offered a director role and being in a position to help start up a facility. That's pretty exciting and interesting. That's awesome. And I love that you touched on, having those conversations like in your role now as a palliative nurse with family members, because it is definitely a hard conversation. But I can totally level with you on that, of that I myself as well have been in on those conversations at work. And I don't know, it is kind of a sensitive topic, but it is in a nice way to connect with a family and like you said, educate them and really advocate for kind of the best level of care that you want for that individual, right? And that's kind of, I think, what we're doing, and that's what it's all about. So I'm happy that you mentioned that. I know you shared a lot of what you do, but is there one thing that you would say I guess, would you say that education and mentoring is kind of what you love most about working in long-term care?
Yeah, that's exactly. Because I think I've seen nurses there who've been there for like 10, 15 years.
Yeah.
And I think, sometimes when you don't see the guilt outside, we got rusty, right? So it's always an opportunity for me to just grab them. Chris, I can't insert hypodermophysis.
Yeah.
Can you do it for me? Nope. I said, I'm not going to do it, but I'm going to walk you through it.
Yeah.
Okay. So let's grab some equipment and let's do it. So
yeah.
They do appreciate those kind of approach, having someone to teach them and, get those confidence going. Because I think it's always good to have a sustainable team within your department. So
absolutely.
If I'm gone one of these days, who's going to do it? Something like that. So they have to be independent in doing that.
Yeah. Yeah, I think that's kind of one of those underrated things about long-term care that people, they think of those, the skill set of long-term care versus an acute setting in a hospital or whatnot. And leadership, I think, is really an underrated thing. And you need leaders on your team in long-term care to really have a good functional team and to provide the best care, right? So it's important, especially from a manager position. You're not just stepping back from face-to-face contact with the residents, but you are still involved in, it's not just an administrative role. So I bet your staff really appreciate that, because I know I would appreciate that in a manager as well, having them really involved.
Yeah, that's very true. I've been getting some reports, and whenever I'm in the ward, they do appreciate.
Yeah.
And then there's always like a classroom, 5-10 minutes talking to the nurses, what's going on with it, what to expect like that. So these are the things that you'll expect for this resident. So be wary about it, like, oh, this is a Bell's palsy, it's not a TBA. Why is their facial drooping, that kind of thing. So, yeah.
Yep, taking the time. Yeah.
Taking the time, yeah, that's true. And I think another one that has been in our facility, which is, I think, in Canada, is the MAID program.
Yes.
So
Okay.
the MAID program also has been introduced in not say introduced, but there are a couple of residents that have applied for that. So it's a very good experience as well, because we don't have that in Singapore or even in the Philippines, but having go through that, and it's also a good learning opportunity for me to learn more things about MAID. And now I think they so-called modify the law about MAID. There are some new things about it, so that's very interesting.
Yeah. So for anyone listening, just to clarify, that MAID is medical assistance in dying. So, and that was introduced, I would say, around maybe 2016. Is that about right?
Right.
To become legal here in Canada. So it is definitely something new and interesting, and that's very unique to be involved in that. And so
it's a different perspective.
Yes.
It's a different ball game when you talk to the family about it. So it's palliative is palliative, but this MAID is another story. So I think it's
absolutely.
Really, it's really good.
Yeah. Okay. Well, I don't want to take too much more of your time, but is there one piece of advice that you would give to nurses, particularly some of the clients of care that would very well maybe starting off their careers here in Ontario in long-term care? So,
Well, I think it's lifelong learning. So we will never stop learning, even if you're in that state or even if you're in that position, you never stop learning. Try to get more of the things and educate yourself when there's an opportunity, something like that.
yeah,
Yeah. I
great.
think for me, that's the best part that I can always tell my colleagues or new nurses to never stop learning. Yeah.
Okay. And I was going to ask at the end, but you've kind of touched on it already, if there's anything else you want to add. But as you know, their care center celebrating 20 years of success. And you've already mentioned that working with Michelle as your caseworker, you were really appreciative of the support she gave. But anything else that you wanted to shine the spotlight on for what CARE has done in your journey?
I think it's the awareness and the orientations of how the healthcare delivery system in Canada is. Like by providing those short courses, I think it's a very good opportunity for internationally trained nurses to just, have a view of how these particular skills are done in Canada. So I think that is a very good initiative of Care for Nurses as well.
Awesome. Well, thank you so much again for taking the time to speak with me today, Chris.
No problem. Anytime.
Hi, Olivia. Thank you for taking the time to speak with me today. To start off, would you like to share a little bit about yourself, your current role, what setting you're working in, and perhaps a little bit about your nursing background, which led you to where you are today?
Yes. Hi, Vanessa. Thank you for calling me. My name is Livia. I come from Romania. I came to Canada 14 years ago. My background was a registered nurse in Romania. Worked in the ICU unit with newborns. Came to Canada and right away applied for registration with CNO. Unfortunately, my education did not meet the CNO requirements for registered nurse. So I was told that I can apply for the RPN, which I did. And right away I got my license. I took the exam and I got my license as an RPN. Started to work as an RPN in long-term care, and since then it seems like I enjoyed long-term care, and even now I work in long-term care. It took because I realized that the healthcare system was quite different than what we had in Romania. I decided to go to take more courses on my own. And this is how I met one of my friends, and she recommended CARE. That this is how I started with CARE, and with the other organization that supports international educated nurses. I'm missing the name now. But anyways, I did English communication in nursing. I took courses for medication administration at Moha College. And then that's when I applied actually for CARE to have some support to pursue my wish to obtain the RN license. So this is the time when CARE got more involved in my case. And I had quite few case managers that were giving me advice on how to approach CNO and how to look at all the possibilities that
Sure.
are around to obtain the education and the experience for the RN license.
Okay. And so what sort of role are you working in now? You said you're still in long-term care.
I'm still in long-term care and I work as an RN.
As an RN.
I got my license in 2020, right before the pandemic.
Wow.
So,
Okay.
yeah.
All right. And so are you working in, I guess, the greater Toronto area kind of thing, or kind of west of Toronto there?
No, I work in Hamilton.
Oh, you do?
It's
Okay.
Idlewild Manor is my new place. Actually, I changed the places. I worked for 9 years at the Willow Grove as an RPN and then 1 year as an RN. And I just moved to Idlewild Manor in Hamilton.
Okay, cool.
Which is part of the Thrive group, I think.
Okay.
Yeah.
Awesome. And so, on the topic of long-term care, what do you love about working in long-term care? Since you've been working in long-term care now for, I guess, almost 15 years, or not, at least 10 years. So, yeah.
Yeah. Working with elderlies, you might say that it's not that exciting as with newborns.
Yeah.
But if you look at the other side of your job and you think that you give them comfort and you are actually their family in long-term care and you give them support in the last days of their lives, that gives me the feeling that I accomplish what I wanted to do with nursing. So,
yeah, just supporting individuals and being there for them, kind of thing. Yeah.
Yeah.
That's
they're like, I always think that I come from newborns from one end, beginning of the life, and then now I work towards the end of the life.
Yeah.
And I can find some similarities between those two ends. Both of them have different way of expression, and if you are able to read and understand those expressions, it is a rewarding experience and job.
Yeah, no, and I think you really kind of hit the nail on the head by saying that you are like their family. I know for me at work, there are many families that come and are there and able to visit their loved ones, but that's not the case for everybody. So the staff day in, day out are there, and especially in this last year, I'm sure you've seen that change and shift, that not as many visitors coming in or not allowed to even come in at some points, that it has been so important for the staff to be there and support the residents, right? So it's so true, and such an underrated thing, just to have somebody there that really genuinely cares for you. So okay, and what do you find is a challenge of working in long-term care?
We do have many challenges.
Sure.
Lack of staff is, I think, it's a major challenge.
Yeah.
We would like to have more staff and be able to interact more with the residents, because that's what I think we are missing. We have recreation.
Yeah.
We have physio that spend time with them. Mealtime is important. But if we would have more staff, we would be able to engage more of them and have the time to listen to them.
Yeah.
I think that that's very important, time to listen to them. It's essential. This way you get to know them, you get to know their what makes them happy, what makes them sad. And of course, it's another challenge. It's I would say documentation. It requires a lot of documentation. Sometimes even double up, like we write the same things in multiple places, just because those are the ministry requirements. So would be beneficial for the residents and for the staff if we would have a more simplified documentation. I know that in nursing it says if it's not documented, it's not done.
Yeah.
But if we can find other ways to document everything that is done,
your tasks,
would be better.
So, are you using electronic documentation, or do you guys still do paper charting?
No, electronic.
Oh, yours. Okay. Okay, that's good. That's good. At least, yeah, it helps a little bit, I'm sure. But of course, with the ratios of staff to residents, it makes it really challenging. I think, especially. I don't know what your ratios are, but say for me, I know on an evening shift, I have up to somewhere between 30, 40 residents kind of that I'm overseeing. And to document, there's a lot that happens in the course of a shift. And yeah, you might not be documenting on all of them, but you got to keep track of everybody. And that is, I think, a very valid point that you do have the personal support workers helping for care in that. But at the end of the day, it does fall onto our license and our responsibility, right, as registered staff. And that can definitely be a challenge at times.
Yeah. And of course, you need to take the time to see and monitor, let's say, for pain and if the medication is effective or not, or if you need to look at some changes. And you when you are in a hurry, you might miss some of the signs that can tell you more than what you see.
Yeah, totally. With that being said, do you have a piece of advice? So this podcast is kind of geared towards, of course, other clients of care. And as I'm sure you know, a lot of RPNs especially start their careers off in long-term care because there's such a demand there. So do you have one piece of advice for nurses considering working in long-term care?
As I said, long-term care is a very challenging place to work, but also very rewarding. When you see the smile of the residents, that shows you that you did a good job on that day, and or if you see a resident that tells you, I don't have pain anymore, you helped me, that's rewarding. And for the new staff, the new registered staff that will go to work in long-term care, be patient, listen, look around, spend time with the residents, get to know them. Assist PSWs if it's needed, because that's how you get to see how a transfer is made. Maybe you need to do some changes. This is how you see pressure points for the skin, and you get to assess the skin. be present.
Yes. Yes.
It's very, very important.
Yes, I totally agree. Yeah.
It's
Yeah.
not just medication
Mhm.
and treatment.
Mhm.
It is more than that.
Mhm.
Collaborate with the interdisciplinary team.
Yeah.
Talk to the physiotherapist, talk to the physician,
Mhm.
talk to the recreation, talk to the social worker.
Yeah.
We do have many resources, and if they are used properly,
Yeah.
I think we can make a difference in our residents' lives.
Totally. Yep. Communication. That is definitely a big takeaway. The proper communication and keeping that open communication is huge, I think. Yep.
Yes.
Okay. I don't want to take too much more of your time, but as I kind of mentioned to you earlier, it's Care Center is celebrating 20 years of success. And so I know you had mentioned that you got in touch with Care already after you'd gotten your RPN licensure and were working towards your RN. But is there something that you really loved about Care Center that you wanted to shine the spotlight on to recognize them after their 20 years?
So I have to say, without their support, without Care support, I would not have got my license as an RN, because I was at some point when I was lost in the process, and I did not know which direction to take.
Yep.
So my case manager at Care kept in touch with me and advised me on the paths that I could take and how I could get to my final destination, the RN license.
Awesome.
So we always had a good collaboration, and I am very, very thankful for everything they did for me, because it helped me to get where I am right now, and I really enjoy working as an RN.
Oh, that's great. I'm so happy to hear that. And thank you so much for taking the time to speak with me today. And
You're very welcome.
I wish you all the best.